Well, I want to welcome everybody to the Bylund Clinic Podcast, where we take time to explore the challenges and opportunities at the intersection of psychology, education, and family life. I am, of course, your host, Dr. James Bylund, and in the past, we've taken some time to explore the topic of problem recreational screen use, the impact on mental health, the impact on learning and school performance, as well as some basic strategies all parents can implement to establish some healthy boundaries around recreational screen use in the home. But today we're really going to take things one step further and really take a look at technology addiction from the perspective of clinical treatment. And I'm super excited today to be joined by Alex Basche, a licensed mental health therapist who's an expert in the area of technology addiction and treatment in children and adolescents. And he works directly with families and young people around problem internet gaming, social media, screen dependence, and really is just going to bring a wealth of knowledge and experience to the conversation today around evidence-based treatments for kids that really work. Of course, we're going to talk about technology addiction, but we'll also dive into some topics around technology addiction in children with neurodevelopmental disabilities like ADHD and autism. We'll take a look at the intersection with mental health around anxiety and depression. But most importantly, we want to talk about things parents can do today to really establish healthy screen boundaries in the home that are going to support their child's development rather than hinder it. Now, Alex, maybe just take a moment here and you can tell our listeners a little bit about yourself and your experience. What got you into this area of treating problem recreational screen use in children, and maybe a little bit about the services you provide?
Sure. Yeah, thanks so much and really happy to be here. Um so for me, I found my way kind of into this work back maybe about 15 years ago or so. I was working as a behavioral specialist, doing behavior modification work for kids who were struggling with difficult behaviors. And I kept meeting kids and families where technology was kind of the, like invisible third party in the room. And, I was able to help treat their anxiety, ADHD, depression. But what stood out was just how often screens weren't just part of the issue, they were shaping it. And kids would say, they couldn't sleep because of late night gaming. Parents were feeling locked in power struggles around devices. Families would describe a sense of disconnection, even when sitting in the same room together. And that all just made me realize, okay, well, there's got to be an expert, right? There's got to be some people around here that are focusing on this. And there wasn't. And so that was really the turning point for me. And that really pushed me to kind of focus on this.
Yeah, no, for sure. I mean, I think yeah, I mean, for me, I think was introduced to it with my oldest son when he was young, and sort of recognizing, or my wife honestly recognizing some of the issues around his behavior that really seemed to correlate with his screen time. But yeah, I've run into the same thing. I mean, we've been talking about this topic and with parents in our clinic, and even doing presentations on it for a number of years. But as big of a problem as it seems to be, certainly in our clinic. Yeah, there aren't enough people out there with real expertise in terms of diagnosis and treatment of screen disorders.
Yeah, yeah, truly. And I'm really trying to champion more of that and trying to encourage all the interns that I work with to also try and do that to go into the subspecialty. So if anyone's listening, please, we could use you.
Yeah, for sure. And I know you do professional development, right? Because we've got it
Yeah.
lined up for our clinic to benefit from your professional development as well.
Yeah, yeah, absolutely. Looking forward to it.
Now, as far as like from a treatment perspective, right? Like, how would
Mhm.
you distinguish maybe regular or even heavy screen use from something that's more of an actual technology addiction that's going to require treatment?
Yeah, and this is of course, right, like a really common question because people will, of course, understandably want to know, hey, does my kid meet criteria? And of course, providers want to know, hey, how can I recognize this, and where's the clinical boundary when we're talking about someone who's maybe using technology too much. And the answer is it's not even really just about how many hours someone plays, it's more about the impact. So
Hmm.
if, a teen is playing 3 or 4 hours a night, but they're still sleeping well, keeping grades up, hanging out with friends, and they can stop when asked, then it's heavy use, but it's not addiction.
Wow.
Um, yeah, but it's really when the gaming starts like kind of like crowding out sleep, if mornings are like impossible because they've been up until 2 a.m. Grades are slipping, friendships are fading, especially if they've tried to cut back and can't. That's when we're looking at something more serious. And I'll often say to parents, think of it like, eating dessert, right? Even if you eat dessert every day, it's not necessarily unhealthy. But if that becomes the only thing your kid eats, right, then you've got a problem.
Yeah, for sure. So re really looking at what the fun like you said, sort of the functional impact of it, like how, in what ways is it disrupting sleep, school, relationships, other activities, and things like that. Now,
Just trying to draw the distinction between like what an addiction is because it's, someone I'll also sometimes hear teens say, hey, well, if someone really likes to play soccer, right? What are you going to say they're addicted to soccer? It's like, well, is soccer taking away from their life or is it adding to it? So I think at the end of the day, just as you just said, right, it really comes down to how is it impacting one's life? Yeah.
Yeah, for sure. And I've heard that analogy come up myself too, like particularly around like esports, right? Which have really seemed to take off
Yeah.
in recent years. And like we don't critique somebody who's spending hours and hours playing basketball in order to train for the high school basketball team, but we might do the same for esports. But I think one of the
Mhm.
distinctions, at least in my mind, around that too is there's a lot of, say, health benefits, right, around physical movement and activity and being outdoors and being part of a sports team that aren't all present, when it comes to esports, which might, lead to, a number of different health, negative health consequences of being, sitting still in front of a device for hours on end. But it is an
Yeah,
interesting comparison for sure.
absolutely. Definitely. Yeah. And I mean, with esports, it's interesting because I've also treated some people who were pretty talented esports wise. And their training regimen is brutal. I mean,
Yeah.
these guys, they're not like playing for hours and hours, right? They're training, they're practicing, practicing keyboard movements, and it's hard work, and it's not necessarily like a blast the way like I think a lot of teens might think of it. The reality of it is actually pretty hard, and a lot of them get repetitive motion injuries in their hands and
I can imagine.
yeah, yeah, it's not easy, certainly.
Yeah, it's a whole world I honestly know very little about, but it's obviously growing in popularity, and you've got high school and college teams and professional teams that are not doing this.
Yeah, yeah, exactly. You can even get scholarships to some colleges these days.
Yeah, I had a young man I worked with who was looking to go to UC Irvine on a possible esports scholarship.
Wow.
So it's yeah, it's that was one of my first introductions to it. Actually, it's like wow, you get a scholarship for esports to a UC.
What a time to be alive.
Yeah, seriously. Now, one of the things we certainly see in our clinic, because we do a lot of, assessment and diagnosis of neurodevelopmental disabilities, and we see a lot of kids with, ADHD and autism, certainly even like learning disabilities too, that are spending a lot of time engaged with recreational screen devices. And I was just, curious in terms of your clinical experience, how might this show up differently? Perhaps in kids that have ADHD or have autism versus sort of the general population or neurotypical peers.
Yeah, it's an important question. And, with ADHD, for example, it's the most common co-occurring disorder among folks struggling with digital addictions or gaming disorder. So it's something I also encounter quite a bit. And autism is also in the top five as well as is OCD. And I feel like a game could be a place for someone, for example, on the spectrum where everything clicks, right? The rules are clear, the feedback is instant, success is tangible. And not only that, but for kids who have spent their whole life struggling socially, struggling to pick up on nonverbal cues, feeling like the odd one out every single interaction, this is the great playing field leveler because you're not in person. You can't see the person, right? You can't see the people you're gaming with. So there's no nonverbal cues to pick up on.
Sure.
And so I'll often hear from parents, they'll say, gosh, like I go to pick up my kid from soccer practice and he's, you know, really trying to take up as little space as possible. And he's looking down, he's not engaging with the other kids, but the second he puts his headset on and starts gaming, he just blossoms. It's like, oh my God, there he is.
Yeah.
And so I think as a result, it just makes it, of course, all the more complex. Because if that person is also struggling with their use, does that just mean you take it all away? And I think no, I think definitely not.
Yeah.
So I think it can actually be something that's pretty important in facilitating socio-emotional growth and in facilitating interpersonal relationships. Um, it's, again, goes back to moderation. So, I guess a good example is like a neurotypical teen might play Fortnite to relax, whereas a neurodivergent teen is playing Fortnite because it's like really the only way they can feel competent or socially connected.
Yeah.
And so that requires, of course, and really demands a gentler, more nuanced approach that honors the way the tech is meeting their needs.
Yeah, for sure. It's a really important point, and it sort of immediately took me back to a kid that I knew from a couple of years ago, where that was exactly the case for him, right? Like this is a place where he was socially successful. It was very predictable.
Mm.
He had friends that he gamed with and had sort of established relationships with online, and a place where he was socially very successful. Versus the real world where he experienced a lot of social challenges, and yeah, I mean, it is a really fine line to be able to walk between those two. Sort of like a follow-up question I have then too is sometimes, at least what I've read about, right, it is a lot of times sort of excessive, gaming as an example can even diminish social skills in a real world setting, right? So even like a typically developing kid seeing like reduced eye contact, for example, just reduced social engagement, outside of their gaming world, like and sort of I guess it just sort of leans into some of the complexity that you described around, this being a place where they experience, success and social connection. But I don't know if you can sort of speak to that at all too. I mean, you mentioned sort of like moderation, but wanting to make sure that this is something that's benefiting them, but then also not taking away from their development outside of that ecosystem.
Yeah. So like what does that look like in terms of balancing it for kids that are more neurodivergent?
Yeah,
So it's definitely a tough one, and it of course really, as all treatment does, needs to be very personalized and customized. And I think where providers sometimes slip up is when we think that if something worked for one client, it's going to work for another. And at the same time, there are, I think, some like hard and fast rules, right? So if someone is saying, well, I can only or like I have to play between the hours of, 11 p.m. and 2 a.m. because that's when my friends are online. That right ends the school night. It's like, okay, bummer, right? Like, sorry, but that's now putting your sleep right behind in the priority level, right behind your gaming, and that's not okay. So it's this constant balance of, all right, we want to make sure you're still gaming and able to connect with your friends online, and that those aren't your only friends, right? So it's just about balance. So, okay, so if you've got three best friends that are, leaders in your guild in your game, maybe you need 1 to 3 friends, right, in real life too. And that's kind of like a rule of thumb that I try and impart to parents really is that, right, so if he's saying that he can't go to a social event, or she's telling you that, she needs to stay home for this guild event on Sunday and not go to this family event, that's up to you as a parent. But if you're going to let them do that, then there needs to be something that they're doing in return to kind of counterbalance it. And the reason for that is that if that habit, right, or that sort of maybe approach of, okay, I've always got to balance it out with something positive in real life, if they can internalize that, then they'll always be in balance, right? Then right, it makes it kind of hard to over, over focus on gaming and fall into the depths of an addiction.
Yeah. Yeah, it sort of makes me think too what you're saying at the outset, right, around the functional impact, right? So, are we able to manage our screen use, and in this case, like our gaming, without it having an impact on family relationships and going to a family event, or without having an impact on real world, face-to-face interaction and relationships with other people? That makes a lot of sense. Another sort of fine line that we run into in our clinic, you know, beyond sort of neurodevelopmental disabilities are sometimes, mental health challenges like around anxiety and depression, where what we've seen is that a lot of times whether it's gaming or some other recreational screen use starts to serve as a bit of a coping mechanism for these kids who are experiencing high levels of anxiety or social anxiety or depression, but equally can become a trap that sort of sucks them in. And I'm sort of curious, what you have to share or around your experience or how you manage that fine line as well.
So what one of the things that I think is really maybe less important is when people get and often it's the teen, right? When they get a little bit more focused on, well, this doesn't feel fair, or this doesn't feel right, or I'm bored. Um, and I think often I try to interpret that through the lens of whatever else is going on. So if someone with anxiety is saying like, I'm bored, I'll maybe look at that instead as like, okay, are you trying to tell me that you're anxious, right? Or when parents will say, well, but my kid is saying that, they really don't like doing this activity. And yet when they start doing it, once they're actually there, right? Once they like get over the hump of the resistance and avoidance, then it's great and they have a lot of fun. But it's too hard to get them there, so we're going to quit.
Yeah.
That idea of avoiding discomfort or of, demand avoidance, or, there's so many different kind of ways to conceptualize this. Like at its core, that is addiction, right? That is dependence. That is um, one of the many ways that we as humans cope with discomfort
Yeah.
is we avoid it. We procrastinate, right? Who hasn't procrastinated on a homework assignment or a work assignment or task? So it's very human. And I think step one is kind of honoring that and trying to respect it and acknowledge that it's valid. But with kids with anxiety or depression, for example, right, it's about self-soothing. So they're trying to regulate their nervous system and they're trying to turn down the noise of the world. So when parents step in and say, you know what, this gaming is ruining your life, and the teen feels like, okay, so you've totally demonized, right, the one thing that's keeping me afloat right now, the one thing that I can look forward to after not avoiding discomfort the whole day, right? After facing it at school and everything else. And now you're telling me it's bad, it's evil. I think it's important to hold both truths,
Hmm.
right? And, so I'll often say to teens in that situation, look, it makes total sense. You use this to calm yourself down, but we also need to figure out other tools. This can't be your only lifeline.
Yeah.
And I think, again, I always go back to the same thing of like balance, right? Balance and moderation. So it can't be the only thing. And if it's the only thing, then 9 times out of 10, there's a problem. So once the kids or teens or young adults see that, we're not trying to rip away their one coping mechanism, we're just trying to expand it, we're trying to add to it and create some balance, then typically people will open up to the idea of, expanding their resilience a little bit.
Yeah, that's a super important point, and that's certainly in line with what we see too. Is that a lot of times these kids that are experiencing, distressing emotions like anxiety or depression, seeming to use the technology as a way to escape and provide some relief from those experiences. So what you're saying is like it's not like completely discounting that or removing it, but sort of helping them to develop other strategies that they can utilize beyond just sort of retreating into an online world.
Yeah, and looking at, well, why do you game? What
Yeah.
does it do for you, right? What are you getting out of it? And really going beyond just like, oh, well, it helps me cope, or oh, well, I get some social connection. And one of the ways that I do that is there's an actual assessment, a questionnaire you can use called the Gaming Motivation Scale, the GAMS. And by giving the teen that or the young adult that, we can then really dig in to like what's underlying some of their motivators because
Yeah.
those same motivators for gaming, of course, are going to be reflected in every other part of their life. So
Yeah.
there's also, just to say, there's plenty of ways to harness their use of gaming in a way that's therapeutic without needing to actually like game with them, right?
Yeah.
Like, like that's obviously not the path forward. Um, so I also try and encourage parents to, sure, if you're gonna check out the game with the kid, fine. But don't make it too much of a habit because again, we want to model that there's more to life than just that.
Yeah. Yeah, I really sort of kind of to key on one of the things that you just said too, which certainly makes a lot of sense to me, and sort of like in a similar fashion when we're doing our assessments for say a kid that's not going to school, right, refusing to go to school, one of the things that we always try to look at then is what's the underlying function or reason why they're not attending school, right? Because that seems to help us better understand um, what's going on and to be able to provide some help and treatment for that versus just like the number of days they miss during the school year, for example, isn't, nearly as helpful sort of understanding what the reason underlying the school refusal is. So that certainly makes a lot of sense and sounds like it would be really helpful in treatment and really sort of like leading into the next question that I had too, when parents come to you, with a child or adolescence that's, experiencing possible tech addiction, one, what does that, assessment look like? And kind of sort of building on what you just shared, what are some of the things you're looking at beyond just, the amount of time that they're on devices?
Sure. So when a family first comes to me, I'm not pulling out a stopwatch, kind of like you're saying, asking like how many hours are they playing necessarily. We're trying to map the whole ecosystem, right? So how are they sleeping? What's their social life like? When they're hungry and they come home from school, what do they tend to reach for? Do they reach for anything, right? Are they feeding themselves? Do they still see friends face to face? What's the family rhythm like? What are the family rituals? Are meals shared, right? Some families used to have dinner every night, and now it's just down to Friday nights, and soon after it's not happening at all. Um, and so looking at what used to work as well. And, of course, we got to screen for all sorts of other clinical issues like, other co-occurring disorders, trauma, because usually tech is just the most visible symptom,
Hmm.
right? That's kind of the end result. So we're looking at can they regulate emotions without gaming? So if, they go on vacation or if their family's from another country and they go to visit family and they can't bring their desktop computer with them, how do they regulate emotions on that trip?
Hmm.
Are they losing track of time? Right? Can they like game for 30 minutes and then go, okay, it's time to get off so I can go to this appointment. So again, going back to balance. So things like that, right? Trying to get a fuller picture, not just of the teens functioning, but how the family's functioning and how the family is um, trying to cope with what the teen's struggling with.
Yeah. Yeah, so super important. And I imagine all of that, of course, is then really helpful in developing a treatment plan and sort of following that line, around treatment. I've read a number of different, articles around, different treatment approaches, whether it's, cognitive behavioral therapy, motivational interviewing, dialectical behavioral therapy, screen detox protocols, for example. What are some of the sort of treatment protocols that you've found helpful, and then also if there's some differences in terms of how you might go about treating a gaming disorder in a child versus an adolescent.
Yeah, so with a child, of course, there just hasn't been the time usually to develop, what we might consider to be a clinical addiction. Um, and so often, at that point, I'll try to first encourage parents to understand the benefits, right? Because games, in our field, often, not always, certainly, but often can be seen as a negative influence. So we'll also examine, right, how it boosts confidence, right? Or foster social connection or stress relief. Um, but then we'll want to also look at co-creating, right, video game guidelines, right? Um, so there's a couple of like hard and fast rules, right? So if every time your kid plays this game, they end up getting frustrated or otherwise emotionally dysregulated, whether it's during the game or because it's time to stop the game, you got to cut that game out. It's
Mhm.
just that simple, right? Because if you replace that game with a food, okay, every time they eat this food, it like makes their behavior totally change, like, Dr. Jekyll, Mr. Hyde.
Yeah,
Odds are you're probably not going to buy that in the grocery store. So why is this any different?
right.
Other I think things that are fairly common sense for homework must be complete before gaming, no games before school, right? Daily exercise, ideally, or at least, a couple times a week, is required. Um, and so I'll try and get parents to adopt more of a mentorship approach rather than a monitoring approach. So, again, understanding the appeal, respecting the interests, collaborating to find a balanced solution, trying to tap into their creativity. So, okay, here's the issue. As your parent, I'm trying to get you to, take a break and go on a walk with me, and you're not doing it. And I'm feeling like, gosh, what else can I do other than take it away? I don't want to do that. So help me come up with a solution.
Mhm.
So seeing if that can help too, because and for some kids, they that actually can do wonders. Um, so things like that. And then obviously with teens, it's a bit different because at that point, right, they might actually be really having some like pretty significant clinical issues with the gaming. And even if not, it's such a vulnerable part of childhood development, right? When the brain is going through that pruning process, keeping what they're using and cutting out what they're not. And so if what they're using is too much gaming, right, it's going to completely rewire their reward system in their brain, oftentimes in a way that's actually semi-permanent. So, you know, obviously I'm not saying, okay, if your kid plays too much games, then, they'll forever have something horrible or scary. Of course not. But it will have an effect. And that's what we're starting to see. So it's so critical to lock in these healthy behaviors now so that they can carry that into young adulthood.
Yeah. Yeah, for sure. Yeah, and I know a lot of this sort of kind of goes back to, having that balance and prioritizing certain things, prioritizing sleep, prioritizing homework, prioritizing, family time. And I know one of the ways that, when we talk about it, sort of an analogy we'll use is sort of like uh, uh, I mean, we think about the foods that we consume as being, sort of having a healthy diet, right? But what does that plate look like around, recreational screen use? And certainly there's a place for it, right? But probably half of that plate is making sure we're getting enough sleep, and then other parts of that, right, are time with family, time doing engage in physical activities, time outdoors, time completing your homework, time doing sort of other recreational or extracurricular activities, and certainly there's a place for it, but it can't consume the entire plate or significant portion of that plate, and sort of sort of building on what you're sharing around what parents can do around creating boundaries around their children's recreational screen use. I imagine parents play a pretty important role. When you're treating technology addiction or other problem recreational screen use. And I'm curious, in your opinion, what are some of the changes in the home that really seem to have the biggest impact on effective change?
So one of the biggest changes is just being age appropriate or developmentally appropriate. So that means you're not expecting a 13-year-old to manage their own screen use,
Yeah,
right? Why can't he just get off, right? Why is it that I have to keep coming in and telling him to stop playing? Well, because his brain isn't developed enough,
right.
right? So he's just not there yet, and that's okay. Where we get into trouble is where we're placing these unrealistic expectations. So for one, and I've done that myself with my own kids, certainly, because it's just so easy to forget sometimes, right? Oh yeah, that's right. Just because you've made this like big step in your development doesn't mean suddenly, right, all these other parts of your life have fallen into place or whatever it is. So taking a step back, going, okay, is what I'm expecting reasonable for this age? The answer is yes. Then, okay, let's look at again, how is the family system operating as a whole? Are we as a family wanting to change our relationship to technology? And if we're not wanting to, do we need to? So once we've answered those questions, we're also going to look at, all right, well, as a parent, my role, of course, is to take care of my child, but it's also to take care of myself. And if I'm not taking care of myself, then I don't take care of my child, right? We have the classic, I think at this point, a little cliche example of, when you're on an airplane, you got to secure your mask before helping others.
Right.
So parents, of course, play a massive role in treatment. But I feel like at least in treatment, step one is looking at their life. So how's their self-care, right? Are they getting enough sleep? How are they preparing, or how are meals being prepared at home? And how is everyone functioning with each other? How are the relationships? So looking at, are there changes that need to be made structurally, from a family system background? Are there changes that need to be made in the parent's life? Are there changes that need to be made in the teen's life at home versus at school versus in the community or with friends? And so trying to change those different sort of ecosystems. And then, I think another role that families and parents can play in particular are modeling the right behaviors, right? So if parents keep their phone in the kitchen instead of next to their bed, that one change, right, now might dribble down to the kid. So now maybe the kid's expected to do the same.
Yeah.
And that way it sends this message that, we're all in this together. Right? We're all trying to have a better relationship to technology.
Yeah.
Something that I'll sometimes have parents do is I'll say, okay, draw like a pie chart, right? So just draw a circle, and then each section of the pie is going to be, activities that you're doing each day. So, you have your self-care, you have your social, you have your work, and then look at how much is left over for fun. And I'll have the teens do the same thing, except, of course, that pie is also made up of gaming. So with gaming there and with gaming removed, look at how much of a difference that makes in terms of what time you have left over. So how much of your pie is being taken up? And then having the parents and teen kind of compare and contrast, then they'll flip it over and they'll draw, what do you want it to look like in an ideal world if we had a magic wand here? what would you truly want this to look like? And that can be a pretty powerful experience, just something that simple. So sometimes I'll even encourage parents and teens to go home and just do that, as an activity, see what it brings up.
Yeah, no, it sounds like a great exercise for the family to do. A couple things sort of came up, for me as you were talking there, just around parents sort of modeling the behaviors that they want to see in their kids around recreational screen use or just device use. I mean, maybe it's dad checking email or something like that at the dinner table rather than engaging. But certainly one of the things I've experienced as a father myself, right, is just my kids are wonderful hypocrisy detectives, and if we set some boundary for them, they sure are really good at keying in on when I'm not abiding by the same standard. And so yeah, I mean, I think sort of setting up the sort of shared expectations of everybody in the household around recreational screen use and parents abiding by those rules as well too is super important. And another thing as you were talking there too sort of came to mind was just around years ago, the American Academy of Pediatrics had more sort of firm lines around like how much screen time at different developmental levels, and they still have it at the younger ages. But
Mhm.
for school age children and teens, kind of going back to what you're saying around like a balanced perspective and having that pie chart, is just around, okay, here's all the things that we need to be doing to be developing into a mentally and physically healthy young person. And then making sure we're doing all of those other things, and then whatever time's left over there, if I can fit screen time in, and that's what I choose to do in my leisure time, then so be it. Because if we're doing all of those other things, they're protecting us. One, it crowds out a lot of the time. There's just not that much time left in the day for recreational screen devices if we're doing all the other things to support our development. But then all those other things then also serve as protective factors against the potential adverse impact of problem recreational screen use.
Yeah.
Now, one of the things that I certainly hear from parents of teens who are maybe spending too much time, whether it's on social media or online gaming or YouTube, it is just the teenager maybe not seeing it in the same way as their parents, not recognizing it as a problem or
Mhm.
recognizing the functional impact that those around them may be observing. And I'm just curious, in your experience, what you do or what you recommend, parents or others do to really engage the young person in treatment without experience just constant battles, every time they're asking them to get off a device.
Yeah, so one is, trying to have, of course, starting out in a more collaborative role, right? Trying that kind of mentorship role I was talking about earlier. And so starting with, the easier, softer way and working your way up from there. So rather than leading with, being very firm, first, let's see, right, if you can do it collaboratively. Maybe we can skip some of these steps. Um, Unfortunately, it's typically not the case, but it's good to try. And if, the kid's still not getting off and they're still not stopping and there's conflicts, that's really, of course, where there needs to be things like, limits that are set, both in terms of verbal limits, but also in terms of actual digital limits, right? So that's where the parental controls come in. If phone is an issue, sometimes people will put software on there or they'll use, more uh, secure phones like so Bark and Gab
Yeah.
um, are two good examples of that, where right, it's like a phone created specifically for the purposes of restricting it. So from the ground up, it's sort of built to be secure, or at least more secure. And then also, in terms of what parents really can do at that point, so you've put on the restrictions, let's say, and you've come up with a family media plan and a plan for how much time you want your kid or teen to play. Um, and you got all that going. But when you try and get them off, even when the computer, turns itself off because their time is up, they still explode or it still leads to conflict, or they're constantly asking you for more time and begging you for more time, that's where we really need more of an alternative activity menu to be created. That's really where making sure sometimes even before those limits are put in, you first really flesh that out. So one thing I'll do is I'll say, okay, here's a list of like 2,000 different activities, some of them put together by ex-gamers. So people that, kind of get what you're going through. I want you to go through that list and circle activities that are interesting, activities you would like to do, but also stuff that you wouldn't hate if you did it.
Sure.
If you did that activity, it's like, okay, it wouldn't be terrible. And then we'll make a menu and we'll organize it in a way that makes sense and flows well for the teen. And so that menu isn't something we try and work into the family. So when it's Sunday and okay, your game time is going to be up, let's say at noon, and you're about to sit down to start playing at 10 a.m. First, before you're allowed to play, you got to go to your menu and let me know what are you going to do afterwards.
Mm.
So priming them to really try and pick that. Because once you've done that, once you know what's happening next, and you know it's an activity, right, that you like or at least you won't hate because it's from the menu, makes it a lot easier to transition. And
Yeah.
over time, that becomes a habit. So it's like, okay, game time's up. Bummer. All right, on to the next thing.
Yeah. I love that idea. Yeah.
Yeah, so that can be a big one.
Yeah, that's great. Yeah, one thing I've come across, in the past, 10 years or so when I've been, sort of researching this topic and learning more about it, is this idea of like short-term screen detoxes, right? Where we're
Mm.
removing all recreational screen activities. I mean, some things may be allowed, right? Like, co-viewing a movie with the family or school activities or things like that. But really going through a period where we're really restricting, access to recreational screen activities. I'm curious from your clinical experience, when you may have seen that helpful and when sometimes, maybe sort of, backfired or be contraindicated.
Yeah, I think the detox is really important actually in treatment, um, because it, of course, is kind of doing a reset, right? It's like if the computer freezes, you do a hard reset. That's what we're trying to do to their reward system in their brain. And, the term gets thrown around a lot, frankly. And what I like to do when I'm talking about this is for one, say that not everyone needs it.
Yeah.
It can be very powerful, but it's not always necessary. And sometimes it can even do more harm than good. So I think for one, it's really also important to first evaluate, all right, is this really needed, right? Have we tried other things? And it just seems like no matter what we do, the same issues keep coming back. They keep sneaking. Like that's a big one, right? So if the teen or young adult keeps sneaking and they're like taking a credit card or they're finding ways around the limits, no matter what you do, and you've been trying everything, that's usually okay. That means it's time for detox. And it can be really powerful. So when I've worked with kids who've done that, we've done everywhere from 3 days to a week to a month. Um, but honestly, I I often will recommend something even longer, and I'll say more about that. Um, but just to say that, like, whatever the time frame is, when when that first happens, the first, couple of days, that's when restlessness, irritability, anxiousness, depression, and sometimes really escalation can happen. So it's really important going into it that parents are very well. So I have a whole checklist that I use to prepare people for the detox because when it happens, we want them to feel ready, right? We want the teen or young adult to be like, okay, here's this listlessness and apathy coming up. Yep, Alex told me to expect that. So
Mhm.
I've got my, sensory coping kit right here, or I've got these fun activities that are already scheduled ahead of time that my folks and I already picked out. So I know I'm going to go to like laser tag later today to help jumpstart, right, my dopamine system a little bit. Um, so having things like that in place is important. But it's powerful because you also are showing them how much control technology has had over their mood and routine,
Yeah.
right? Because it's not just mom or dad saying, "Oh, you're addicted, you're dependent," right? They're experiencing it firsthand. And so I really try and foster a lot of insight like, hey, let's be paying attention to what's coming up in your body. Like, what are you noticing is different in how you're feeling in this moment, right? And getting that insight coming up. Um, and so we talk about it as not a punishment, for one. That's really important too, right? We don't want them to think about this as something punitive, right? This is actually a moment of growth. And they've spent so much time counting down until when they can get back online that now we're kind of doing the opposite, right? So they can sometimes start counting down to when the detox is going to happen, right? There can be a lot of anxiety around it. So again, the preparation is important. Framing it as a tool, right? Not a cure, that it can be incredibly helpful only when it's paired with reflection and good replacement, right? So we need to have, the activity menu ready. Um, and sometimes it can be helpful even to start with like a small reset. Like, okay, let's try it for a week and let's
Mhm.
just see how it goes. Um, because what I'm building up to here is that really, for someone who's genuinely really addicted, and I don't throw that word around to be clear, 3 months is kind of critical. You can't do less than that. It's really got to be something like 90 days minimum. And there's really got to be a lot of behavior changes too. Those will come, those are going to happen naturally. And what I usually hear in the first 2 weeks is it's hell, it's really hard. But then 90% of the time, parents will say, "Oh my God, Alex, I have my son back. Oh my God, our daughter she's here. I haven't seen her like this in years." It'll be really emotional, really powerful. So that's why we put all this work and time in to really making the detox successful because it can be pretty amazing. But it's not a cure. It doesn't mean all the behaviors magically change.
Yeah, it's interesting that you say that around like the 2 week mark. My oldest is 14 now, but I would say when he was 5 or 6, probably 5. Yeah, my wife really kind of keyed in on it and was like, I think it's the devices. And when she first said it, I was like, I don't know, honey, but sure,
Mm,
let's take him away. And
sure.
we kind of went cold turkey with it. We're like, okay, there's not even a TV on in the background, and of course, with a 5-year-old, it's a lot easier than when they're older. Um, but yeah, it was around that 2 week mark where suddenly we just saw this, massive shift in his behavior, and the frequency, intensity, and durations of tantrums like
Mm,
were greatly diminished. Was doing better socially in school, was doing better academic. I mean, it was like this whole like shift in how how he was functioning at home and in school, and it was and I remember it being around that 2 week mark, and we gradually started to introduce more screen time after that, but for a long time kept it at a pretty low level for him. But yeah, it was right around that 2 week mark where we saw just a massive shift in his behavior.
Yep. Yeah, exactly. And it's really profound and can be, of course, so powerful to see, and of course is also really hard to get to that point.
Yeah,
But yeah, and when it's needed, it's really needed, and it often can be the thing that makes it so we don't have to look at higher levels of care.
yeah,
Um, and that's again also pretty rare that we have to look at those higher levels of treatment. But yeah, I mean, again. detoxes definitely have their place, certainly. I've even talked to some parents who have done it with their teen or young adult, um, and have also reported like, wow, okay, that was really hard, and I'm so glad I did it.
Yeah, for sure. For sure. And one of the sort of thinking about my son again too, and doing it when he was young, and again we maintained pretty strict just boundaries around recreational screen use as he was growing up. But one of the real benefits that I'm observing now at 14 years old, and now he's got a device that goes to school with him. He has a phone. We like to say it's our phone and we let him use it because we still sort of maintain physical control of it, when he's, comes home from school or he needs to do homework or when he goes to bed at night and things like that.
Yeah.
But it is amazing because we had this kid that really seemed to, check a lot of boxes, around um, just sort of his um, propensity to become like really addicted to these devices. And now at 14 years of age, if he's on YouTube and we say, okay, click out of it or close the computer, he doesn't love it, but he does it,
Wow.
and sort of setting them up at a young age for to be able to better manage screen use as they're getting older. And so I'm sort of curious too, what are some of the things that you might recommend to parents of younger children and steps that they can start to implement at young ages to maybe prevent future problems associated with recreational screen use.
Yeah, and I mean, let me just say it's very impressive to hear that you have a 14-year-old who's able to do that. That is phenomenal. And absolutely, it speaks to all that work that you were doing when he was much younger.
Yeah,
And, where this is what I often tell parents is, hey, you can pay for it now or you can pay for it later.
yeah,
And it's always going to cost more later.
yeah,
So what can parents do? Well, I think just like you were saying, right? Looking at, is this adding to their life or is it taking away? So something that I'll I'll do sometimes is we'll look at, okay, let's map out when they are using the tech. When is it not an issue? Like, what are the times, even if they're, pretty rare, where they were able to stop or where it seemed like their use put them in a better mood? What was happening? And more often than not, parents will find there's usually something. There's some sort of secret sauce or reason. Sometimes it's because, oh, well, it's after their homework's done. And so they're not they're gaming at that point just for fun. It's not as a way to procrastinate and not get their work done. But it's not something they're aware of. So I need to, bring that to my kids' awareness. Um, but, in terms of prevention, it really goes down to, for one, yeah, looking at what is the, what are the recommendations from, whichever medical body I think is relevant to me. So what are the experts saying I should be doing? But, also when is it no, when is it, not making a problem? And when do I, as a parent, feel it's important that they're not doing it? So as a parent, maybe again, Sunday mornings is fine, Saturday morning cartoons for a younger kid, fine. But after that, you want them up and out and outside because it's going to be a nice day or something. So that maybe means that in the future, with prevention, you need to just build that in that, okay, in afternoons on Saturdays, we're always going to have something scheduled or planned or what have you, even if it's just, again, like we're setting up a play date or something. So scheduling out activities, using activity scheduling is important because that goes back to the pie chart, right? How much time is left over for gaming? Looking at, are they isolating, right? Are they missing out on important life experiences because of the gaming? If the answer is yes, then you need to reduce it or change when it's happening, making sure that self-care is really being prioritized. Not just like, oh, it's important that you get enough sleep, but like, hey, that's a priority. So you're modeling, right, that your phone is living downstairs, not in your room, because your priority is sleep.
yeah.
same thing with school, right? So looking at academics and, around here, I see every day just how much pressure, we put not just on our kids, but on ourselves, right? To get it right, to be perfect. It's easy to feel, like you're falling short. And I think the truth is that parenting is messy. Mistakes are
Mm,
part of the package, right? And mistakes can also, of course, be opportunities for growth and change. So trying to look at where those opportunities are, but also that it's okay to be imperfect. So it's okay if maybe, Johnny played a little too much today. Okay, sure, it happens, right? Whatever. But what are you going to do now? How do we counterbalance it?
mm,
So just always trying to play that moderation and balance game. Um, Another thing that's really helpful for parents is coordinating with kids' friends. So if, you, your kids' rules are that they only get gaming 2 hours a week, but their best friend gets to play 10 hours a week, you can guess whose house your kid's going to want to go to. So making sure as much as possible to coordinate the screen rules, that is like a secret weapon. That can really make a huge difference.
yeah. Yeah, no, that all makes all makes a ton of sense, and I can see too how it's kind of continuing kind of comes back to having appropriate balance and seeing where the screen devices fit into our lives, and the other thing sort of coming up for me as you were sharing that is just, and this is something that we'll talk with families about too, is just really sort of establishing and having a conversation about and just making clear what our values are as a family. We value sleep, we value, working hard in school. We value physical movement. We value spending time together as a family, and then starting to couch like how, how does recreational screen activities, fit in with those values, right? And what are the things that we're prioritizing? And sort of other thought that kind of came up for me too. We're talking about like what are these other activities that we can be doing, and then where does recreational screen activities fit into that. One time I came across this statistic, and I'm going to blow it because I don't remember the exact numbers, but I'll get the gist of it. And I remember it completely blew my mind. And then years later, I went back and with ChatGPT now sort of tried to verify the statistics. But it was you're talking about the amount of time that kids from say age 5 to 18 spend engaged in recreational screen activities. And, here's where I'm gonna get the numbers wrong, but it was like over 10,000 hours, right? Like, 10,800 hours or something like that. And then they compared that to the number of hours that one needs to put in order to earn a college degree. And it was less than half that number, right? It was 4,800 hours or something like that. And when I used ChatGPT, it gave me slightly different numbers, but the ratio was basically the same. And what sort of my takeaway from that was like, gosh, and not to say that we shouldn't ever be have leisure time or just do things to relax and go on social media or play games, but gosh, if we're spending over 10,000 hours doing that, even if we cut that time in half, what are all the other things that we could learn and skills that we could develop if we were engaged in other activities, right? And for me, that kind of goes back to the idea of family values and what are the things that we value as a family and what are the skills that we want to be able to cultivate, in our children too. And that was definitely one of the big things with our son too. When we got rid of screen devices, boy, there was a lot of time to do other things. And certainly think he benefited, a lot from some of the various activities we got him involved in, when he wasn't on a device. Now, I think you sort of
Mm.
my final question, well,
Mm.
not my final, second to last question here for you. And you sort of kind of touched on it, but maybe if we just were to kind of distill it down to like one, like if there were one or two things that like every parent listening to this right now, things they could do or steps that they could take, that you would recommend to, help develop a healthy relationship around screen devices, in the house. What were those one or two things be?
So one or two things that, like, if I had to pick that to
Yeah, just like steps all families could take to help their children develop a healthy relationship with screens.
yeah, so hmm well, I think to start with, right, it's critical we get them to the point of having balance and moderation now, because And one analogy I like to use for this, right, in terms of like, right, here's like a couple of like really important aspects to focus on is that, if you're trying to learn a new language as an adult versus as a kid, it's way harder.
Yeah.
So we're trying to teach them this language of balance and moderation now, so they don't have to struggle in the future. And, one good way to do that is having a family media plan.
Yeah.
So having a plan that, okay, we're all going to agree to as a family, and maybe it's separate from how you moderate their gaming, but instead it's more just like, okay, as a philosophy, or we're not going to have phones at the dinner table, or on Sundays we take a family walk and Friday nights we have dinner together. So having things like that in place structurally at home are really important. So it's not just focusing on your teen or focusing on your kid, because when that happens too much, you know, hating the game or gaming can start to feel like you're hating the player. And that's often what clients will report to me in those situations is that, they're feeling like their parents are, kind of demonizing or otherwise pathologizing things that they're passionate about. So making sure that it's clear, hey, I understand the role gaming plays in your life. Um, and I guess if I could recommend something else, it would be um, don't use ultimatums without follow through, and don't use screens as rewards as much as possible. Obviously, you know, if that's the only thing that works and you're in a pinch, of course, understandable. But generally, if you don't have to, trying to not use screens as rewards because it tends to foster the wrong kind of behaviors and attitudes that
Yeah.
parents usually want.
Yeah, no, no, great advice. Yeah, I mean, one of the things that I've experienced along those lines, too, is when we're using screens as a reward, over time, needing to increase the amount of reward, right? Like kids demanding more and more time on the device, for example.
Exactly.
When we start doing it, that what worked as a reward the first time, 10, 15 times down the road, is no longer sufficient, right? And they're negotiating for
Mhm.
more time. Um, you mentioned like screen use sort of agreement or family plan, around screen use. I know like Common Sense Media, I think, has something like that available at their
Yeah,
website. Are there ones that you like, or places you might direct parents to if they're wanting to develop family screen use agreement?
definitely. So the Children's Screen Time Action Network, they're part of a larger advocacy organization called Fair Play. And I should disclose I'm also an advisor on one of their boards.
Awesome.
But I think they're fantastic and they do a lot of good work. And they have a great sort of tool you can use online, and you can, you know, parent types in their part, and then they switch seats and the teen sits down and types in their part, and so on and so forth. So you have the whole family kind of adding to it, contributing to it. So they feel like they're invested, right? And it's a collaborative process. It's not just, mom saying, hey, this is how it is, or what
Yeah.
have you. So that can be a good one. Um, there's other ones like Wait Until the Eighth, um, where that focuses more on trying to keep phones out of the hands of kids that are too young for them, and really advocating for waiting until kids' brains get to a certain point. Um, Yeah, and so there's definitely no shortage of good resources online. I think really the one that I try to encourage people to look at the most is just where are the parental controls,
Yeah.
right? So do you have those enabled? Because if you don't, then you have no power,
Yeah.
right? Um, And even if things are going well, I think it's still important to have those kind of things in place because teens and kids crave boundaries,
Yeah.
right? They cry out for them.
Yeah, right. They flourish when there's boundaries in place for sure. Yeah, and I really like that too, and certainly something that we encourage as well is when we're coming up with these family media agreements that we're co-constructing them with the kids, right? When we're sitting down talking about family values, we want to know what the kid values as well too, and how they see the devices fitting into the family's shared values, and again, sort of co-constructing it like you said in order to get their buy-in, but also shared accountability, right? That if we're going to model the same behaviors that we're expecting of our kids, they're able to call us out too when we're not abiding by the standards that we've set for everybody in the household. And I know one of the things too that well, at least what I was, my researching and, reading on the topic and, sleep being, a major, variable in some of the sort of adverse consequences of problem recreational screen use. And I know one of the things in our household that we try to maintain is that bedrooms are screen-free spaces, and so,
Yeah.
there's no computers in the bedroom, there's no television in the bedroom, there's no, handheld devices, tablets or phones. In the bedroom because, in our house, the bedroom's where you go to sleep, and we have, kids have access to those devices as we do, sort of communal areas of the home. And it helps us to monitor it, but it also helps to ensure that, our kids are getting adequate sleep at night. They're not waking up to to game or to go on YouTube or social media or getting, messages and alerts from their friends or whatnot, so yeah, I highly encourage, not having the devices in the room. You just one other quick question here, Alex. I just want you to put in a plug, for those listening in terms of where they
Mhm.
can find out more about you and the services you provide.
Sure, yeah. So people can read more about me, services. I also have some helpful tips in some blog posts I try and do on my website. It's Reset from Tech, all one word, resetfromtech.com.
Wonderful, wonderful. And Alex, I know we're sort of past our time here, but I just want to thank you. I really greatly appreciate it, and I know the families listening to this are really going to benefit from your time. So thank you so much for joining us.
Yeah, it was a pleasure. I always love the opportunity to talk and share and try and spread the message and word out to parents who might be struggling. So yeah, thanks for the opportunity. It was great to chat.
Yeah, awesome. All right. Well, thanks again, Alex. Take care. Have a great rest of the day.
Thanks, you too.
All right, take care. Now, for those parents listening, I think the big takeaway here is one, technology isn't going away, but also with the right awareness, limits, and supports, finding the right balance, your child can learn how to use technology in ways that support their growth rather than hinder it. Now, if you notice red flags, if you're noticing mood swings, problem behavior, sleep problems, withdrawal from family life, or other impact on day-to-day functioning, please don't ignore it. There are effective treatments out there, and you certainly don't have to face this alone. If you'd like to learn more about the Bylund Clinic and the services that we offer, you can visit us online at www.thebylundclinic.com. And thank you, of course, for listening to our podcast. If you found this episode helpful and you haven't already, please subscribe. Also, please share it with another parent that might find it beneficial. And join us next time as we continue exploring ways to support children's growth and well-being. Thanks so much.